My top 3 tips for managing acne in general practice: throw out everything that's in the cupboard, number 1. Get them onto a simple routine where they've just got the basics. So the use of a retinoid, an SPF and a good cleanser. Think outside the box when it comes to what we can add with antibiotics, number 2. So light therapy. Most of the patients in our practice do not need to be referred to a dermatologist, probably only about 5%. And with the adjunct of LED light therapy in conjunction with the antibiotics and our topical agents, we can usually get most of our patients much better within 2 to 3 months. And probably only 5% of our patients would need to be referred on to a dermatologist. Point number 3, treat every patient, no matter what the degree of their acne, whether it's mild, moderate, severe, as just as important, because even a mild case of acne for a teenager can be quite a debilitating and psychologically impactful disease. So when we see an acne patient for the first time, it's really important to take a very thorough history. And that involves everything from their dietary history, their family history, social history, how they're feeling about the acne, their psychological impact it may have on them, and also trying to work out whether there may be a hormonal trigger that's contributing to the acne, or perhaps they may be on some medications that are making the acne worse. So importantly, with teenagers, it's worth knowing whether they've got a family member who had a history of acne or had to be referred for Accutane, because if that's there, it's a bit of a red flag that they may need to be referred to a dermatologist perhaps sooner than we would with an ordinary patient. Also, if there's a history of scarring in either parent, would also lead us to be a bit more concerned about getting onto the acne earlier. Dietary history is very important and often missed out in a lot of consultations, so we need to find out whether they are actually consuming a lot of soft drinks, and specifically ask that question, because there's no doubt that a sugar load can contribute to the growth of the P. acnes. If they are consuming a lot of refined carbohydrates, eating a lot of sugary foods, find out whether they've got a nice diet rich in leafy green vegetables. That's really important to encourage. And also try and minimise their dairy intake, because there are plenty of studies now that if you're consuming more than 2 glasses of milk a day, for instance, it can be making your acne worse. In teenage boys, particularly important to ask about whether they are actually consuming protein powders or energy drinks, because all of these have an effect on the acne cycle as well. Particularly things that they use to build up muscle mass in gyms have casein and whey powders, which can make the acne worse. With a female, it's important to find out what their period cycle is like. Are there any pointers to PCOS, for instance? Do they have problems with weight gain? Is there a family history of diabetes? Are their periods perhaps heavy and irregular? All of these things might make us think about measuring some hormone levels, and particularly perhaps insulin, testosterone. Those sort of hormones could be making an issue. And then we look at what they want to do as a career. So if a person's keen on becoming an actor or getting on stage, where their face is an important part of their presentation, we need to get onto acne early and fix scarring before it happens. When it comes to joining armed forces or the police force or being a pilot, it may be a bit of a red flag for prescribing Accutane, because we do know that Accutane can, in rare circumstances, cause a condition called night blindness, which could negate their ability to join the armed forces. So have a good think about what's happening in the teenager's life. So perhaps, are they suffering from psychological impact from their acne? A lot of people feel depressed because of their acne, but we also want to know if there is a family history of bipolar or severe depression, because it could also be a considerable red flag for Accutane prescribing. So all of these things must be looked into and thoroughly assessed before starting any medications.